Hello class, my name is Osvaldo Gomez and today I will be presenting embolic stroke with right side hemiplegia. What is an embolic stroke? An embolic stroke involves obstruction within the capillaries, arteries, or arterioles in the brain. Whenever there is an obstruction, it prevents blood to flow in the areas of the brain, and this can cause damage to the sensory or motor control abilities of the body. What really causes embolic stroke? The main reason are platelets. Platelets are the particles that can help you heal from cuts. Whenever there is an injury to arteries, this prevents blood flow to not be lost by sealing the wound and preventing more trauma to the body. Now, sickle cells are one of the abnormalities that happen throughout the body, and this means that blood cells, red blood cells, have the ability to shrink, meaning that these can become flat whenever they don't carry oxygen. This is a mutation that affects these red blood cells, and if there is a multiple account of sickle cells, these can travel throughout the body, making clogging of certain organs or majority of the organs, and one of them can be the brain. Plaque buildup, it is considered fat that is stored within the capillaries or arteries, making blood flow more narrow. Now, one of the rarest uh, conditions or actions that the body does is that white blood cells, whenever they travel around the body, and if they find plaque buildup, they can release chemicals in which platelets are activated and start connecting, attaching to the plaque, making more obstruction for cells to travel throughout the body. And if there is plaque buildup in the brain, there is an obstruction that can be considered a stroke. Thrombocytosis, it is platelets that account for many, such as 450,000 cells. And if there is majority of these platelets, they can travel throughout the body, similar to sickle cells, in which they can injure the body. How does an embolism affect the body? Well, as said before, the brain needs oxygen to operate. If there is an obstruction of oxygen, such as the picture on the left side, this is a healthy brain. But on the right side, if there is an obstruction, it creates an infarction. An infarction is seen as this dark spot that is pointed by the arrow. Now, there is damage to the body whenever there is an infarction, leaving the body more weak or unable to perform daily activities that you used to, such as walking, grabbing a glass of water, washing dishes, etc. Thrombocythemia, it is similar to thrombocytosis. However, the platelet count for these are above 450,000, but more for 600,000 cells. If this is a condition that happens in the body, this is a high alert for people to seek medical services and see if they have the chance of having an embolism that can happen anytime. What is one of the things that you can do to prevent strokes. The main prevention that you can do, or one of the things that you can do to prevent embolisms, is eating healthy. Having a really healthy diet minimizes your chances of getting sick, and uh, a bit less chance to acquiring or getting infected from such gases or chemicals that surround your area, your environment. Active lifestyles improve your metabolism. So whenever you keep your body active, this reduces your chances of getting sick, and it strengthens your muscles, your metabolism, your cells to heal and to make a better approach to fighting infection. Medication. Medication can be considered one of the easiest methods for people to get cured. Now, in the case of embolism, you can you can take hydroxyurea, and in the case of thrombocythemia, this is one of the medications that you can take to prevent the activation of platelet formation and reduce the count. Now, last but not least, you have to have a stress-free environment. Having constant stress can weaken your body, and such as working out improves it, but stress reduces your chances to healing. So having a positive mindset, eating really well, and avoiding stress keeps you at a higher chance to improve your body, and more ability to fight an infection and embolisms. Therapy for improvement. Whenever a person already is diagnosed with an embolic stroke, they need to seek physical therapy, because physical therapy involves your training of the body. And in one of the many workouts or routines that they develop for patients is the ability to start practicing daily activities such as washing dishes, climbing stairs, walking around, throwing objects. uh, they practice similar scenarios that can be considered everyday activities, because they will need them to gain their strength and muscle memory back. Now, also, psychological therapy is a beneficial approach that patients should seek for, because a person who has an infection or has a condition in which they can feel more lonely or less likely to heal, they need great support, and they need to have the ability to express their mindset, their feelings, and have an approach or a positive approach or support that can help them cheer up and fight fight for their health. Life after a stroke. Well, such as having a therapy session with a counselor, you need to keep a more calm mindset after your body changes. Having your body change by not being able to walk the same way, or have less force in one arm, or having this tingling sensation, it can make a person feel very negative about themselves, which it is a very bad position for patients. So Having a more calm mindset promotes the ability to heal, change your lifestyle. If you're a person who constantly consumes alcohol or smokes, once you stop using these products, you have a more chance to improving your body and a more approach to fighting infections or reducing conditions that can affect your lungs, your kidneys, your liver, pancreas, etc. Seek advice for future prevention is one of the things that many people, such as right now, like me, are trying to promote so that people can be aware that this is a real problem and that not many people will or are talking about it. And lastly, surround yourself with positive people. Always try to surround yourself with positive people because they can help you feel more cheered up. They can help you improve your body. They can support you into attempting to go to these training workouts or motivate you into continuing your rehabilitation programs. So having good company improves your mindset into attempting to train or memorize your ability to have daily activities back. In conclusion, embolic strokes is it's a critical condition in which if there is not precaution of this, it can injure the body in a way that it can make a person feel more and more unable to have a more active lifestyle. However, once an embolism happens, this doesn't mean that this is the end of the world, or more a chance to rehabilitate yourself, to seek more help, to improve your lifestyle. Joining therapy sessions or working out or consuming less addictions such as alcohol or smoking can prevent your body from getting injured, and it reduces your chances of having mutations in your genes in which it can have a less chance of having thrombocytosis or any abnormal condition in which can injure your body. So thrombocyte embolism stroke is a very high, it's a condition in which you need to be really careful and you need to have more precaution of what you do and how you approach life. So this is the end of my presentation. I hope you enjoy it and have a good day.